State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases.
So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. So at the end of this definition, there are 15 different options on how you could be classified as a probable case. Based on this diagram and what they report, there's a total of 17 cases now. One is still only confirmed because that was that original index case who then had all these contacts underneath in orange. And all the rest of them became probable, but they are still considered a case.
This has the potential to be a very significant event for us here in Texas and here in Collin County, as the state now has elected to adopt this new probable definition. If you have a subjective fever and you have a headache and you live in Collin County, you now meet the qualifications to be a probable COVID patient. It is remarkable how low the standard is now. Mm-hmm. If you have one of the major symptoms, you have a cough or you have shortness of breath, and you live in Collin County, then you can satisfy the definition for a probable COVID case. But I'm very concerned that we absolutely could see the numbers jump very rapidly in a way that actually is not indicative of what we're seeing here in the community in the public health department.
That video was from May 18th. That was from a month and a half ago. Have you been wondering what's going on with the COVID cases? How they just been skyrocketing here in Texas? Watch, this video is going to explain it. This video was leaked. Just wait till you see the next clips. The common media has been telling you that the reason for the cases going up so much is because of the protests and the riots. Man, how about what they were saying in February and March? That this is such a deadly virus and it spreads so easy that you gotta be careful, you gotta put on a face mask, you gotta quarantine yourself because it's so dangerous outside. Yet, what you just saw was tens of thousands of people gather all over the country and in some parts of the world. Could you imagine if this was really as advertised, a virus of that level? There would be piles of people on the streets. Piles of people, all kinds of people, not just the elderly or the people that are already really sick, but all kinds of people, especially the youth, people from the ages of 17 to 30, 35, like that age group. You would see a lot of those people in the street dying because this virus is so deadly. But guess what? It was proven by those protests that it's clearly not as deadly or as contagious. So then how are these COVID cases going up? You're about to see in this video what they're doing with the probable cases. Also, they're messing with the deaths as well. If someone had, say, kidney problems for 7 years, and one day those kidneys fail and that person dies, if they happen to have had COVID, they're going to be counted as a COVID death. They're messing with the numbers. They think you're a fool. And for that reason, they're telling you lies.
And let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
So check it out. If you tested positive for COVID, that doesn't mean that you had the symptoms. It doesn't mean that you were hospitalized. It doesn't mean that you were literally dying on deathbed. If you just tested positive, just that, they're also lumping in to the case count, the case number, all the probable people you came in contact with. Up to 15, 17 people, they're adding to one person that tests positive. Because what they're doing is they're taking the legitimate positive tests and they're lumping those together with probable cases into one figure. Continue watching.
State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases. Probable case definition was adopted by the Council of State and Territorial Epidemiologists back in early April 4th or 5th. They adopted this. They sent it to the CDC, and the CDC did take that recommendation and adopt it and send it out to the various states.
So there you go. Probable and confirmed COVID cases are now one number. And that's why you're seeing your numbers shoot up. You think this is just happening in Collin County? If I was a betting man in Vegas, I would go all in. This is happening in other places too. Not just Texas, but other places too. Not to mention, Dr. Ron Paul also came out and spoke how this is fraudulent. You also have the COVID deaths. If someone dies with no test, in other words, they did not take a COVID test, but they died, but they happened to be around somebody that was either tested positive with COVID or a probable case that we know they didn't receive a test, but now they're lumping them together, right? So if someone dies with no test, they just die, and they were around a confirmed COVID tested person or the probable people, that person that died gets counted as a COVID death. Again, fraud. Keep watching.
So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. Meaning if you use another testing method, not PCR, and if you have close contact with a confirmed or probable case, and if you did that lab work that was not a PCR, you could be considered a case with or without symptoms. They also updated the definition for deaths related to COVID-19. Previously, prior to this definition, it was only if you had a positive PCR result that you would be counted as someone who died related to COVID-19. Now that lab testing is no longer required to be counted towards that.
We already knew that they were faking the numbers. We already knew from like a while ago that they were, like if somebody got bit by a shark and eaten alive there in the ocean, they were like, latest COVID tragedy. Tonight at the 6 o'clock news, full clips coming ahead. And then you just see this guy get eaten by a shark. That's satire, but that's literally what's happening. And we knew that was happening. Even Elon Musk was telling people that's what's happening. And I'm not his biggest fan or anything, but even that guy is out there going like, hey, what the hell? Like you guys are counting all these deaths that are not even COVID deaths as COVID deaths. He even called out Amazon for banning a book that was written by a very notable doctor, and that doctor was calling out all these same things. So there's clearly something happening with this pandemic. It's becoming very political. Just like Rahm Emanuel said, don't let a good crisis go to waste. They're using this crisis to just push and plow their agenda. And that's literally what this has become now.
So if you do the FDA-approved testing, which right now is serology, looking for antibodies, IgG, IgM, you have to have the clinical criteria. And if you don't have that, and then you have the EpiLink, then you could still be counted as a case. So if we look at the yellow box here, that's the approved testing, right? If yellow, you have the test, and then you have any of the blue, you're a probable case. If you're yellow and you have any other close contact, which doesn't mean you're sick, you're a probable case. And then if you don't do any of that lab work, and then you get sick and you were a contact of a case, you are then counted as a probable case. You have to be a close contact of someone who's a confirmed case of COVID-19 or a probable case, or you came to a location where it's endemic. Right now, Texas has stated that they are considering the state as an endemic area. So that means if I just went and got serology testing done with no symptoms and I was positive, whether it's saying that recent infection or current infection, my new antibodies, or it's like I've had them for a while, I would be counted as a probable case. So basically, these 3 boxes, you can be yellow and blue without green to be counted as probable, yellow and green without the blue, and then blue and green without the yellow. But for the blue and green, if you had contact, that has to be within 14 days. So let's say activity dies down, slows down, and we're not considered endemic. Then we need that 14-day. But right now, that 14-day doesn't matter. Moving forward, it may, when activity slows down. So at the end of this definition, there are 15 different options on how you could be classified as a probable case. Okay. So that same scenario, a little bit more extended. Now, if we look at it with the new probable case definition, where some individuals had the FDA-approved testing of IgM, IgG, some individuals just had contact with someone who is classified as a COVID case, whether they are confirmed or probable. So at the end of this, based on this diagram and what they report, there's a total of 17 cases now. 1 is still only confirmed because that was that original index case, who then had all these contacts underneath in orange. And all the rest of them became probable, but they are still considered a case.
Also, Fauci and these guys are saying that wearing the face mask is so important. The governor here, Greg Abbott, just came out saying that it's the single most effective way to prevent. Are you kidding me? If someone farts and through their underwear, through the jeans, and through your mask, you smell it, what does that tell you about your mask? The particles. If this was an airborne virus that was as lethal as it says it is, or like it stays on surfaces and it's as lethal as people are saying it is, the mask wouldn't do a thing. You're consenting to gagging your face. That's what you're actually doing. You give to the government what belongs to the government. Yeah, you give them your taxes, you give them your tax dollars, whatever. But your breath, you give them your breath. I'm telling you, there's bigger things happening here. Again, look at these clips from Elon Musk. Look at these tweets. And look at what he's saying about this doctor. This doctor will be played at the end of the video. And look what he says. He literally says, hey, this guy's right.
Now, by the people are insisting on refereed reports. No one wants to share anything. The scientists are more panicked and scared of reality than anybody else. The august organizations like Linda, the Royal Society, the National Academy of Science have been totally silent. I am really disappointed. This has got nothing to do with the politics. As a group, scientists have failed the younger generation. There should have been a committee formed either by the Nobel Foundation, by Lindau, by the Royal Society, the National Academy, in the middle of February, when this was coming down the road, and we should have discussed this. Instead, we let economics and politics dedicate the science, and for me, the worst opposition I got was from very, very prominent scientists who were so scared that the non-scientists would break quarantine and infect them. There was total panic, and the fact is that almost all the science we were hearing for example, from organizations like the World Health Organization was wrong. We had Facebook censoring the World Health Organization country views. This has been a disgraceful situation for science, and I have nothing to do. We should have been talking with each other. Reports were released openly, shared by email, and all I got back was abuse. And you're going to see that everything I said in that first 6 weeks was actually true, and for political reasons, we as scientists let our views be corrupted. The data had very clear things to say. Nobody said to me, let me check your numbers. They all just said, stop talking like that.
And I'm only using Elon Musk because so many of you look up to this guy. So for that reason, I'm like, hey, look at what your leaders say. I thought this video was important to make. It was important to share that these conferences or these meetings that these people were having, they were leaked by a whistleblower. This is the kind of stuff you won't see on CNN or Fox or on your mainstream YouTuber. Be vigilant. Do your own research. This is JC Barba signing off.